Welcome and thank you for joining the NCCN Global Policy webinar, Patient Engagement, Driving Access to Quality Cancer Care Globally, Treatment and Survivorship. My name is Robert Carlson, and I am the CEO of the National Comprehensive Cancer Network. Today's webinar is the second of a series of 3 webinars focusing on global cancer policy. The third and final webinar will take place on May 27th, focusing on policy and advocacy. NCCN is a not-for-profit alliance of 31 leading academic cancer centers dedicated to improving and facilitating quality, effective, efficient, and accessible cancer care. NCCN appreciates and recognizes the supporters and sponsors for today's webinar and the webinar series. Without this support, this webinar series would not be possible. Today's program will focus on the resources and policies that advance patient-centered care and shared decision-making throughout the cancer journey, from diagnosis through survivorship. The program will begin with a presentation on NCCN Global Content from Katie Winkworth-Prejnar, NCCN Manager of Global Policy and Strategic Alliances. Agnesa Sarkeesian from the Living Charity Foundation will then discuss the Russian translations of NCCN guidelines for patients. Next, we will hear from Martin Interbitsen, founder of mysurvivalstory.org, who will share his survivorship story. Finally, we will host a live panel discussion that will focus on strategies that advance patient-centered and shared decision-making in cancer care, personalized medicine, and survivorship. Our moderator for today's webinar is Dr. Crystal Denlinger. Dr. Denlinger recently joined NCCN as Senior Vice President and Chief Scientific Officer. Previously, Dr. Denlinger was on the faculty at Fox Chase Cancer Center and chaired the NCCN Guidelines Panel for Survivorship. At this time, allow me to introduce our keynote speakers. Katie Winkworth-Prejnar is the Manager of Global Policy and Strategic Alliances at NCCN. In this role, she works to advance NCCN's global policy initiatives and plays a key role in advancing NCCN global content. Agnesa Sarkeesian is a member of the Board of Trustees of the Living Charity Foundation. Agnesa has over 15 years of experience in executive management, creative strategies, and fundraising. She uses her expertise in project development and community partnerships for the Living Charity Foundation as the project executive for the Russian translation of the NCCN patient guidelines. We will then hear from Martin Interbitsen, founder of mysurvivalstory.org. In 2012, at age 32, Martin was diagnosed with pancreatic cancer. Based on his personal experience, he founded mysurvivalstory.org, a nonprofit initiative that documents inspiring cancer survival stories around the globe with the goal to help other patients and families cope better with the illness and its psychological side effects. Martin studied neurobiology and has a PhD in neuroscience. We are thrilled that they are here today to share their expertise with us. Their presentations have been pre-recorded, but we welcome the opportunity for you to submit questions to Agnesa and Martin during the panel discussion. We look forward to an active conversation today and welcome your questions and engagement throughout the program.
Hello, everyone. My name is Katie Winkworth-Prejnar, and I'm the Global Policy and Strategic Alliance Manager at the National Comprehensive Cancer Network. It's my pleasure to give a brief overview of NCCN resources that are relevant for the global community and ways NCCN is working collaboratively to advance high-quality cancer care worldwide. As a nonprofit alliance of 31 leading cancer centers, NCCN is dedicated to improving and facilitating quality, effective, efficient, and accessible cancer care. Through the leadership and expertise of clinical professionals at NCCN member institutions, NCCN develops resources that present valuable information to the numerous stakeholders in the healthcare delivery system. NCCN promotes the importance of continuous quality improvement and recognizes the significance of creating clinical practice guidelines in oncology appropriate for use by patients, clinicians, and other healthcare decision makers around the world. The library of NCCN guidelines is continuously updated and growing, with 81 distinct guidelines featuring over 200 algorithms that apply to over 97% of cancer cases in the United States. NCCN guidelines and clinical content is utilized throughout the world. Of our current 1.4 million registered users, nearly half are located outside the United States. Last year, there were more than 11.7 million guideline downloads, and roughly half of those were accessed outside the United States. This heat map shows the magnitude of guideline downloads, with downloads in almost every country of the world. The color coding highlights the number of downloads per country. The darker the color, the more downloads. Given the significant and growing utilization of NCCN guidelines outside the US, NCCN is dedicated to ensuring our content is relevant and accessible to physicians, patients, caregivers, and policymakers worldwide. To continue to make NCCN guidelines accessible for non-English speaking practitioners, we focus on the importance of translating NCCN content. We have a growing library of over 230 translated NCCN resources, with translations in over 50 different languages. To address the relevancy of NCCN guidelines for global providers and policymakers, NCCN collaborates with in-country physicians, professional societies, and patient advocacy groups to develop the regional adaptations of the NCCN guidelines. The adaptations account for country and regional level differences. This might include metabolic differences for specific populations, variation in regulatory approvals and coverage landscape, and other differences in the accessibility of resources. The NCCN framework is a tool for physicians to use predominantly in low and middle income and resource settings. The framework outlines optimal care at 4 different resources. These resources are not specific to a region. Rather, they reflect a more generalizable approach for resource-constrained settings. Building on the concept of the NCCN framework, the harmonized guidelines are resource-stratified guidelines that target regional resource availability and practice. Currently, NCCN harmonized guidelines are developed for the Sub-Saharan African and Caribbean regions. COVID-19 has had a significant impact on every aspect of our daily lives, and unfortunately, cancer care is no exception. The pandemic has had devastating effects on patients with cancer, with huge numbers of misdiagnosis and delayed treatments. To address these concerns globally, NCCN recently joined over 300 global oncology organizations to endorse the European Cancer Patient Coalition's joint letter on COVID-19 and cancer. The letter urges governments around the world to identify the impact and mitigate the negative consequences of COVID-19 for cancer patients. More specifically, the letter highlights the need for governments to ensure that patients can access cancer diagnosis and treatment safely. To date, the letter was distributed to all European Union ministries of health, all members of the European Parliament, and representatives of the World Health Organization. Additionally, NCCN, in collaboration with other leading cancer care organizations, have developed several resources focused on the impact of COVID-19 on cancer care screening, diagnosis, and treatment. Specifically, you can find resources and webinars that are designed for patients and caregivers to help address and mitigate some of the significant challenges and barriers cancer patients have faced during this pandemic. These resources are translated into several languages and can be accessed free of charge using the link on the slide. The last thing I would like to mention is the NCCN guidelines for patients. These guidelines are patient-friendly adaptations of the NCCN clinical guidelines. They are formatted to help individuals with cancer, as well as caregivers and family members, talk with their physicians about the best treatment options for their disease. The guidelines for patients ensure that patients are aware of all their treatment and care choices and allow patients to self-advocate for their own best care. The patient guidelines are offered free of charge online, as well as using our mobile application. Currently, there are 54 NCCN guidelines for patients that cover cancer care screening, treatment, and supportive care recommendations. Recently developed patient guidelines include pediatric ALL, immunotherapy side effects, head and neck cancers, bone cancer, and survivorship. NCCN has also recognized the need to publish translations of the patient guidelines. Currently, there are 34 translation patient guidelines in 11 different languages. Last year, there were over 1.4 million downloads of the NCCN guidelines for patient translations. To date, our largest and most impactful translation initiative has been a collaboration with the Living Charity Foundation in Russia. Together, we have translated 14 distinct guidelines for patients into Russian. The work of our colleagues in Russia and the Russian guidelines for patients have had a tremendous impact on cancer care in the region. It is my honor to introduce Agnesa from the Living Charity Foundation to discuss why these translations were needed in the region, as well as the significant impact of these targeted resources for patients, caregivers, and physicians. Thank you.
Hi everyone, my name is Agnesa Sarkisyan and I am board member of Living Charity Foundation. I am honored to represent our project on translation of NCCN guidelines in Russian and their impact, of course. First, let me introduce our foundation. The Living Charity Foundation has been providing assistance to adults with severe illnesses for over 10 years. One of the main programs of the foundation is the Oncology program, in which we not only pay for expensive treatment of patients, but not covered by the state, but also educate the population on the importance of prevention and the importance of seeing doctors at the earliest stages of illness. In frame of the Oncology program, we work with the best oncologists in Russia, and we know the problems they face many years. That was the reason that we responded to the proposal of oncologist Dr. Laskov for the translation and distribution of NCCN guidelines in Russian. In 2018, our fund, together with the Dr. Laskov's clinic, launched the project called the Russian Translation of the NCCN Guidelines for Patients. You can see short information about fund and clinic on the first two slides. This project is extremely important for two reasons. First is the growth of cancer in the country. Second is a lack of verified information in a user-friendly language. According to official statistics, oncology increased by 1.2% in 2018. 98% of those affected are adults. These are huge numbers. These 4 million people and their relatives are our target audience. The majority of population in Russia don't know foreign languages and don't have an opportunity to study English language materials. A person who learns of a cancer diagnosis perceives it as a sentence. Highly qualified oncology treatment is mainly concentrated in major cities of Russia. In order to get good, correct treatment, the patients need to find the right medical centers and oncologist of a certain profile to contact them and get to the reception. It's very difficult for a simple man. That is why many patients seek alternative treatments, turn to non-traditional medicine, and miss the most important time for treatment. After a while, they come to us for help, but often it gets too late for effective treatment. In addition, the doctors themselves need information materials to interact with patients. A year later, after project launch, other charities joined the project. To date, 14 guidelines have already been translated and published, another 4 in the process of translating. And this year, we are going to translate another 7. Our main task is to translate and publish all NCCN patients' guidelines, and of course, distribute them as widely as possible. That's why we are working on joint campaigns with Yandex and Google search engines, involving the medical community and the media. We are planning to work with bloggers and celebrities and of course promote guidelines in social media. This is a very essential project for us, and we can see the impact of it right now. The response to the first press release and press conference about the project launch showed the necessity and the importance of Russian language guidelines for doctors and patients. We also were supported by oncologist Andrei Pavlenko, who became widely known not only for his achievements as a doctor, but also for keeping an online diary about how he was fighting his stomach cancer. Unfortunately, Dr. Pavlenko is no longer with us, but his openness has had a great impact on the attitude towards cancer in Russian society. As you can see from the slide, there were 35 media publications and huge social media coverage. These are incredible figures for a social project in Russia. As you can see from the following slide, the total number of downloads up to date has reached 140,000. I arranged the guidelines according to their relevance. That's a huge result considering that we are just beginning a mass promotion campaign. Now we are analyzing why these guidelines are the most demanded, whether it is related to the increase in these diseases in Russia or if it's a result of advertising campaigns aimed at publicizing these particular topics. Another effect, unfortunately for a long time, there were no professional, reliable and comprehensive source of information in Russian language for patients with cancer. Thanks to the project, now Russian-speaking oncologists have the tool which helps them with just one-click answer dozens of questions asked by patients. Or after discussion, they can share a source where the patient can find all the details in one place. For example, about information on complications or description of a diagnostic procedure. It is also enormously helpful in saving time and resources as patients come for an appointment well prepared. It allows doctors and patients to start discussion at the same position, get to the important points much quicker, and in the long run can prevent professionals' burnout. Oncologists with different specialties join the project and help us to edit and localize translations. The active support of professional community is also a great achievement. Doctors who work directly with patients are the most important channel for the distribution of guidelines. Additionally, another result of the project is the feedback received from the Russian-speaking people from other countries. We received letters from Armenia, Kazakhstan, Spain, and Israel. As it is turned out, there's a problem with studying medical materials in English too. The Russian guidelines make it easier to interact with doctors and understand the course of treatment. That's the impressive impact of our project. We express our gratitude to the NCCN team for developing convenient and comprehensive guidelines. I'll be glad to answer questions and share experience. Contact us.
Hello, my name is Martin, and it's a pleasure for me to be here today and to talk to you about celebrating cancer survivors and patients. I'm the founder of a project called My Survival Story, where we document cancer survivors and patients all around the world. Maybe quickly before I start, I want to give you some data and some information about me and my person. Originally, from a background, I'm a neuroscientist. I studied the brain and emotions, so in my PhD I tried to understand how the brain processes emotion, stress, how it affects our behavior, our social interaction, our physiology. I did a lot of research myself. I published scientific papers, I did experiment. I can say I'm a specialist on this topic, but I had a very interesting learning experience some years ago when I got out of the blue diagnosed with a very nasty and very, very dangerous pancreatic cancer diagnosis. As those of you who know, this is not the best verdict that you can get. It's very, very lethal. A lot of people die from it. And for me, it was somehow an epiphany moment when I realized I had on one side, I had a PhD on the topic of stress and emotion. And on the other side, I had no clue how to cope with the situation. So I like to say, and I learned that from my own personal experience, that knowledge is totally overrated. We somehow all know what we should do when we are facing a challenging situation. We know what would be good, but that doesn't mean that we are actually able to apply that knowledge, to actually change our behavior, to better cope with the situation. And this experience, this personal experience, was really and still is my driving motivation why I'm doing what I'm doing, that I try to translate not only knowledge but also personal experiences into methods and tips and tricks and application that can be used by patients to actually better cope with their own illness, with their own struggle. I myself, as I said, I learned it the hard way. Obviously, when you get diagnosed with an illness like cancer, you're probably interested, you're curious, you want to know what is it all about, and what you do, or at least most people or patients do, you go online and you Google around. And Dr. Google is a good idea if you have a flu. It's not the best idea if you have pancreatic cancer, I can tell you. So I was totally shocked when I read in a random search result that actually 95% of people with my kind of diagnosis die within 3 years. So 95% of people really don't get very, very far. Back then, I was just 32 years old. I finished my PhD. I was ready to start my life, my career. And this really got all like turned upside down. Now, I was lucky that I did not only had good doctors and surgeons and oncologists, but also like the doctor that had to give me the diagnosis. He was very smart and very wise, because he not only gave me the medical diagnosis, he also told me a story. He said, "Look, Martin, I want to share with you a story of a patient that we treated here in this hospital some years ago, and we managed to treat him well, and he's now happy and healthy skiing in the mountains." So this picture of a man skiing down the snowy slopes of the Swiss mountains, it was somehow burned into my memory, into my brain. And every time I got hit by the statistics, by the sad news, by the sad numbers, I was thinking of this person. I was thinking like, okay, there is one person that somehow managed to overcome this illness. So I like to say, I had a personification of hope. And that was enough for me. I just needed that one story. And this story really, really helped me to shift my focus and to approach my own illness from another perspective. So this was approximately 8 years ago. I did something that would change my life forever. I was in the middle of my first chemo, my first half year of treatment, and I told myself, if I ever get alive here of this whole mess, I will do something crazy. And with crazy, I had a concrete idea. So I signed up for a triathlon. I have to add that I never did a triathlon before. I was playing tennis when I was a teenager. I liked sport, but I was never into endurance sport. I never liked running. I did not have a bike. I knew how to swim, but yeah, that's it. I really was not a professional in this field. But somehow this was the attractive side of it for me. Like I was thinking, okay, I think of the most crazy thing, and if I do that, it will really challenge me. It will give me something I can hold on. So shortly after, I started with my training. So this is a picture of me in the hospital on this ergometer bicycle with my chemo connected to my body. And obviously this has nothing to do with the proper triathlon training. But still, this picture and this training unit is up until today one of the most important sessions in my sport history or my sport career, if I can name it like this, because it was the moment I was saying yes to myself when a lot around me and the circumstances were saying no. It was a kind of a symbolic move, a symbolic first little step, and I think that's so important to point out. I mean, it's much more important to focus on the starting line than the finish line. People get obsessed with like, okay, I have a finish treatment, I have to finish a marathon, I have to reach that goal. But I think what's really, really helpful is to remind ourselves it always starts with one little step. And for me, this picture really symbolizes that. And I'm still, when I'm looking at it, I'm getting emotional, like just thinking about this moment when I was sitting on the bike and doing that first training session. So what I like to say is, like, if you want to rewrite your story, and I'm going to talk about storytelling a little bit later, it's really much more important that you pick up the pen than thinking about like how good are you actually at writing. Because when you pick up the pen, you're actually already in the process of becoming a better writer. You're actually already accepting where you are, and you're not so much obsessed, okay, can I write a good story or what is my story about? But you're just like saying, okay, I allow myself to flow into it and to embrace the situation. So this picture of me on this bike was really picking up the pen and just saying, okay, whatever comes. And this is also something I want to point out, and I will mention later with more detail, is like, let it out what is authentic. We don't have to write the Hollywood story or the good story. Like, cancer is an experience that involves all kind of shadow of grays, all emotions, and we should not be ashamed of that. So it's really the first step of rewriting your story is to pick up your pen. So I did the same. I realized that stories are really, really helpful. And I wanted to share stories from other patients because I couldn't find this kind of content back then on the internet. I could find a lot of forums, a lot of blogs where people were just vomiting out their story, and that was not helping me. I wanted to have uplifting, well-told story, and I always say that there are a lot of good stories out there, but just because you have a good story doesn't mean you're a good storyteller. So it needs kind of a craft how to share a story, how to tell a story, and this is what I did. I started this project, My Survival Story, where we traveled once around the world and we collected stories from cancer survivors from all different kind of people, from different cultures, from different countries, sharing their experiences and their perspectives. So I'm very happy to share here with you this little trailer. So as you see, we are not giving people advice. We are asking questions and we let people in the community share their own experiences. And that is important. It's not our goal to tell people what they should do, but to show them that there are actually different things they can do. And then they can select for themselves what fits their own preferences for their own journey. So why do stories work? Stories work because they provide us something or someone to aspire to. And what is interesting about this mechanism is the person or the thing we aspire to should be in a sweet spot of actually be a little bit ahead, but not too much. Because if a person is like far ahead, it's like when you're running and you want to follow a runner and it's too fast, you're getting disappointed and you're getting demotivated. So it has to be in a sweet spot of somebody or something that is just a little bit in front of you, so you still have the feeling I can reach that point too, but it's not too far away. And that is a very interesting mechanism that I started not only to document, but also to study and trying to understand, okay, how can we use that power of a story to help other people and other patients? What I mean by aspire to is that somehow stories provide us with a role model. And I would like to share with you one of my personal role models. It's Dr. Juliet Dharmalingam. She's from Malaysia and she's sharing with us here her little story.
1917, I had a spinal tumor. 1989, I had ovarian cancer. 1995, I had a left breast quadrectomy. 1996, non-Hodgkin lymphoma. In 1998, I had gastric lymphoma. And then in 2003, I had recurrence of gastric lymphoma. In 2013, there was a recurrence of my left breast cancer. And in May 2015, I had a transverse colostomy. That's all.
That's all.
My history. With the chemo, I did suffer because you get nausea, you get feel very weak, you feel miserable and all that. But one of the teachings of the Buddha is whatever rises will pass away. And that I kept telling myself, what rises will pass, what rises will pass. And managed to get over it. Don't fight it, because that causes stress. And once you accept it, you have peace of mind, and you go live your life to the fullest. Don't think about the cancer all the time. One of the survivors is an artist, and she's giving classes on Chinese brush painting. So I attend the classes on Fridays. So I do some painting, and that is very relaxing and helpful. It takes your mind off everything, and you just concentrate on what you're doing. Stress aggravates cancer, and if you can relieve the emotional part, I think they have some peace of mind, and that will help to heal them. As I said before, I accepted it, and if I have to die, I'll have to die. I can't escape death, because when you are born, you'll have to die.
So at the end of that interview, of course, I was totally amazed and flashed. And I wanted to know from her, like, what is your secret sauce? Like, how do you do that? And she was looking at me and just smiled and said, look, you have to understand, like, whatever rises will pass. And it's so simple, it's not easy to accept, but it was really touching my heart to listen to this old lady and to her wisdom and see like how she managed to get through all these kind of illnesses. So it's, for me, a very wonderful example how actually a role model can work and can give us hope to keep walking. Now, let's talk a little bit about authenticity, because I think this is really important when we are like navigating in the cancer community. I like this comic. It's a wonderful symbol for what is happening online, I think. So one guy tells to the other, well, if it's any consolidation, your social media makes it look like you're absolutely thriving. And I think that is what we observed in the past years, that people just pretend they're good. They're like, okay, I'm fine, I'm a survivor, I'm strong. And slowly but steadily, and I'm very happy about it, is we observe that people also share more vulnerability. And I think this is important, because otherwise it seems like everybody is just doing fine and everybody's strong. And if you're at home and you're struggling, and I know from myself, because I had many days and weeks and months where I was struggling myself, it can be very intimidating and demotivating. So sharing vulnerability is really, really key, and being authentic also, because otherwise we're going to twist the cancer experience. We're going to squeeze it, and we make people feel bad who are actually in a spot or in a point in their journey where that can be very, very hard to see. And I also brought with me an example of somebody, for me, which is and was really, really authentic, and that's Sarah. She's sharing here with us an insight that I think is really, really important to point out.
But I have one thing to say, like, despite all of that, I really think that the stuff surrounding cancer about like survival being a measure of will, like your will to do something, is can have a horrible side effect, which is that if you're downtrodden and you're sad and you don't feel like you can go on, it's all your fault and you just didn't try hard enough. I think that's also really, really shitty. And I have to say, there are times when I feel that way, you know, like I cannot go on. I've had it with this. I'm sick of like living my life like this. And I just wish that that wasn't part of what the cancer narrative was, you know, because people have said to me, your bad attitude means you're not going to survive. And they, yeah, I mean, Americans, you know, we're all so happy. And like, if you just try hard enough, everything will be great. I think that's one of the things that is like really damaging about the cancer narrative, and it's like, it sucks sometimes.
So authenticity is key if we want to reach the community. And the second point that is key is that we have to go where patients are, where the people are, where the community is. So we have a website, you can find a lot of information there, but we are mainly online where people are navigating at this point in time. These platforms will change over time, obviously. For us, it's at the moment Instagram and Facebook and YouTube where we are active, and also podcasts. We produced out of the videos a podcast. I think a podcast is a fantastic format for the community, because while you're on chemo, you can just connect your headphones and you can listen to it. This is actually also a reason why we produce mainly videos and podcasts or photos. We don't have a lot of text, because my experience and the experience from other patients that talk to us is that it's actually sometimes really hard to read a long text when you have a chemo brain. So it's really also thinking about, okay, what is the right format for the community to actually reach them with the story that we are sharing. So yes, we have a podcast. You can check it out. It's on Apple, iTunes or Spotify or wherever you find your podcast. And it's a wonderful story. It, I think, shares a lot of wisdom from other patients, and it's made in a very authentic way. At least this was our intention when we are starting to produce that piece of content. Now, I also want to say, talk a little bit about our community and what community means to us. We have a very international community, at least in the English-speaking regions. We reach people all around the world, which is something we are very, very not proud of, but I think it is an asset of our project, because I believe we can actually learn from each other see how other people from other cultures, from other countries are doing it. We also have a community which is very engaging. We have a lot of interactions, and what we learned is that being part of a community has like two helpful aspects. On one side, you can get support. You can get support by listening to others, and on the other side, you can also support each other. You can give advice, you can share your own knowledge, your own experiences, and this kind of shared experiences, it has a unique power. This is something we are tapping into. We also having a lot of interaction with stories, we're asking questions, we're making Q&As. We really try to foster this interaction in a guided way. We provide a framework where people can do that. So I also want to mention our latest project, which is a research study, because we get a lot of good feedback from our community. We know that it works, at least that is our experience or our perception. And now last year, we made actually a study together with the university in Zurich, where we were showing the stories and the podcasts to approximately 150 to 200 people and asking them, hey, how do you perceive them? Like, what is your perception? Is it for you stressful to listen to such a story, or is it helpful? Is it motivating? What kind of emotions are you like experiencing while listening to this story? And it's really amazing to actually now quantify also the effects, to see, okay, here we have really, really positive effects. Here we have to be careful, because in the long term, our vision is that one day we also are able to get into the clinic to support people in a clinical setup with stories, to give them hope. And by giving them hope, by giving them like empowerment, actually helping them to comply with the treatments, do not give up, because in the end it's a marathon that you have to run when you go through a treatment, and your mindset and your mental strength is really, really key if you want to go through treatment. And we know a lot of patients are struggling with that, and I think there is still space for innovative programs to support patients and the mental health issues. So this is what we did. I brought with me a video that summarizes the results, which I'm really, really excited to share here with you.
My Survival Story collects personal narratives from cancer survivors and shares them online as videos and podcasts. The Institute for Complementary and Integrative Medicine at the University Hospital Zurich and My Survival Story investigated together how cancer patients, their relatives, and health professionals perceive such narratives. We chose a participative approach, where citizens and researchers were equally involved. Synergies between team members were strengthened by an external process moderator, who opened the space for establishing a shared language and helped to stay focused. Thus, the expertise and creativity of each team member were able to flourish. About 150 cancer patients, relatives, and health professionals completed an online survey about the personal narratives. The results showed that the stories were perceived as easy to understand, with 90% of the participants indicating positive emotions afterwards. 80% would recommend these kind of stories to others. From qualitative interviews, we identified 4 main characteristics of the stories that participants considered especially helpful. Number 1, positive attitudes toward life. Number 2, encouraging cancer journeys. Number 3, individual coping strategies for everyday challenges. And number 4, openly shared vulnerabilities. After listening to the stories, the participants felt very motivated to share their own stories. That's why we conducted a workshop with interested cancer survivors and their families. After some brief instructions about storytelling and the technical aspects of the recording process, the participants were able to record their stories using a smartphone. Adopting this approach, a do-it-yourself platform might be feasible. Possibly, the stories would benefit from review and feedback to ensure that the main characteristics of My Survival Stories are preserved. The interview and workshop participants of our study would welcome more narratives for My Survival Stories. They especially are looking for stories in different languages and additional stories from relatives and friends.
So I think it's very motivating to see that, but the people get motivated from the stories. They have positive emotion, they would share it, and there are some kind of these aspects how a story should be structure or what components a story should have. And that's what I said before, with like just having a good story is not enough. You need somebody that is able to craft the story, to tell the story. And this is what we do with our project. This is where we see our profession, like our contribution for the community. What we also have to keep in mind is that just because you know that you should shift something, that you should change something, that you see a story, you get a new idea, a new perspective, it's not that easy that you can like implement that directly in your life. So I brought another funky video or funny video that I really like. The one guy at the bar tells to the other, the only thing I've learned from my mistakes is that I apparently keep making them. And that's so true. That is actually true for all of us. It has nothing to do with cancer. And now I'm putting on a little bit my head as a neuroscientist. If we want to change a behavior, if we want to rewire our synapses, our brain, we have to keep trying. We have to repeat what we're doing. We have to give ourselves a positive reinforcement. We have to encourage ourselves. And that needs time. I don't like this saying like, okay, 5 ways to hack your brain. There is not such a thing as hacking your brain. Your brain is a biological tissue. It can grow, it can change. That's an amazing news. So we should not get demotivated, but it needs time. It needs time, and it needs patience, and it needs a lot of self-love. And I always encourage people and patients to be patient, to not give up if they don't get the result immediately, but to encourage them that the result will come. It's with what all I do. Not only with my survival story, but also teaching. It's a lot about like repeating and doing the practice and the methods again and again. So I'm very happy to point out a lecture series that we're holding at the moment at Stanford University. The next session will be on June the 1st. So if you're interested, like how you can work on your own mindset as a patient, or if you know somebody that is interested, you find the link on mysurvivalstory.org. Where you can sign up. It's all for free. I have amazing speakers. Parul and I are hosting this series, and we will always invite different kind of professors talking about different aspects of like mental well-being. So it's definitely a wonderful place to get some new inputs and insights. So as I said, it's hard work, but it can also be motivating. And if we manage to do that, I like to finish my talk with a quote. Is like, if you're able to change the story we tell, we are able to change the life we live. So thank you very much for your attention. It was a pleasure to introduce to you my project. If you have any additional questions, feel free to reach out to me. I'm looking forward to hear your feedback or answer your question. Thank you very much.
Thank you both for your inspiring presentations. At this time, I'd like to introduce our panel today. As we talk, we'll do our best to address questions we receive for the keynote presentations during the panel discussion. We've already met Dr. Martin Inderbitzen and Ms. Agnesa Sarkeesian. Dr. Ortiz and Dr. McKenzie, please briefly introduce yourself, including your name, your affiliation, and your title, and tell us in a sentence or two why it is that you find yourself on a panel discussing the global advancement of patient-centered care. We'll start with Dr. Ortiz.
Thank you, Crystal. And wonderful to be here with everybody. My name is Edith Comenencia Ortiz, and I am the Global Patient Partnership Lead Group Director for Hematology and Pan-Oncology at Roche. And I am here because I have the pleasure and privilege of leading our global engagement with patients and advocacy groups in the hematology and pan-oncology space. So through my work, I'm able to drive co-creation and collaboration with patient communities to help us center the patient perspective and experience in all that we do at Roche.
Dr. McKenzie.
I'm McKenzie. I'm a GYN oncology surgeon at Advent Health Cancer Institute in Orlando, Florida. I'm also the co-founder of HEAL, Healthy Eating and Active Lifestyle for Cancer Patients and Survivors. I also serve as the Fellowship Program Director here at our Cancer Institute, and I'm often involved in global cancer mission work. And lastly, I'm a 17-year breast cancer survivor from high-grade stage 2 triple-negative breast cancer.
So let's start the questions. Martin just presented on his incredible cancer care story and survivorship journey, highlighting the similarities, but also the unique stories that people with cancer experience. Natalie, how does your personal experience with cancer impact your oncology practice as a gynecologic oncologist and the evidence-based work that you do with cancer survivors?
So I think that being a cancer survivor and cancer surgeon and oncologist has certainly given me a different perspective. One towards patient individuality with regards to the patient perspective, their life goals. Secondly, the patient environment. Where does the patient with cancer? So when we focus as oncologists, we focus on guidelines, we focus on cancer, but oftentimes we forget about the patient with cancer. And so when you think about when that patient leaves your office, where is she? In my case, they're all she's. Where is she going home to? What is her environment? What are the stressors at play in her environment? Both the social environment, the physical environment, and her lifestyle. All of these factors are going to play a role in outcomes, and we don't think about these external factors as much when we're too focused on the cancer. So I think that's certainly a perspective that is important. And then lastly, with regards to these lifestyle and external factors, it is probably what compelled me to do more than chemotherapy and surgery and targeted agents, which certainly have their role and have certainly advanced cancer survival for all patients. But the social determinants of health, the other things that are important, including lifestyle, which is probably why I created my 8-week program, intensive program surrounding lifestyle medicine for cancer patients, whereby we take patients through the 6 pillars of lifestyle medicine. The very first week, patients are immersed into education regarding social connections and positive relationships, because we all know from Blue Zone data that that is one of the strongest determinants of happiness and longevity, including for cancer patients, and as well as diet, exercise, activity, risky substances, stress management, sleep, coping skills. And we even talk about other things that are difficult for some providers, like body image and intimacy. All of these are incorporated into this 8-week program, and I'm pretty proud of it. And I don't know that I would have thought of it had I not been a cancer survivor myself.
Sounds like a really wonderful program. And I just have a follow-up question as an oncologist myself. As an oncologist, how do you ask some of those questions for the components of care that are outside of the medical piece, those topics that you talked about when patients leave the office?
Well, sometimes I initiate the discussion with, this is what I think we may need to do for you, or you have 3 options. Tell me more about what obstacles you might face when you're home. What obstacles might veer you to one strategy versus another? Tell me more about what's going on at home. Who do you live with? What kind of work do you do? How far do you live from the cancer center? Is it 3 hours or is it 30 minutes? Do you have small children? Do you not? All of these other things that play a role that often we forget. So the treatment that I may want for you may not be ultimately the best treatment for you. We may have to go to option 2.
Yeah, I think it's really important to think about those things. So Martin, your story and survivorship journey was incredibly impactful. And I have a couple questions for you. The first was your patient journey clear to you, and where did you find the most support? And then secondly, to any patient or survivor who's out there listening to this webinar, how can people begin to say yes to themselves? I really liked that statement that you said in your video. How can they begin to participate in some of those storytelling strategies that you discussed in your presentation?
Yeah, sure. I mean, To the first part of your question, no, my journey wasn't clear at all. I like to say you're not born as a patient, you're like thrown into it, and you suddenly find yourself in the cold water and you don't know how to swim and where to go. So it's like hiking up a mountain, you know, you see you have to go up there, but you don't see the track clearly. Like once you start walking, you see, okay, now I come through the woods, it's tricky, or you come to an open field and it slowly becomes more clear how you have to walk. But I haven't seen it in the beginning. Where I found a lot of support, and that's why I loved what Natalie McKinsey just shared, is like from family members and friends and from all the surrounding. That's such a huge resource. And I love hearing that this gets more and more included in the modern cancer care, because so far we have a very mechanistic approach to the illness. Like, okay, here are some cells, they're doing something wrong, and here is a pill. But then there is all the other aspects of like how cancer invades our lives. And as long as we, that's what I believe, not also take that into account, patients will have a hard time to go through treatment and stick to the treatment. So I think that's really, really important that we keep that in mind. Now, to your second question, like how can you get involved in storytelling, or how can you start telling your story? Well, look, cancer is kind of, it's not a choice. Nobody chooses to have cancer, but how you respond to it, that's a choice. And yes, you can have support from family members and friends, but in the end, it's an opportunity, but also a burden for you as a patient. You have to pick up the pen yourself. And there are like two steps. Like one is to pick up the pen, and the second step is what you're gonna write. And the first step is much more important than the second. Like maybe the first pages will be just a matter of getting out your emotions and your sorrows and your whatever is inside. And then while you're writing and while you're like telling your story, maybe it becomes more positive and you get more direction. If you want to do this like through our project, you can interact with us on social media, you can tag us, you can like hashtag us, My Survival Story. And we get a lot of how you say, feedback, but also positive empowerment of sharing those stories, and reading the stories from others could also be very helpful for you to get started.
Terrific. Edith and Agnesa, I have some questions for you as well, but before we get to those questions, there's a question from the audience that I think is worth sharing. This is from an oncology nurse who was recently found to have glioblastoma and started therapy yesterday. And she would like to know, as a nurse and a patient, so as on both sides of the stethoscope, so to speak, what's the best way to support family, patients, and coworkers? We talk about the fact that caregivers have become part of the story. How do we support those formal and informal caregivers in your life?
I'll take a stab at that question. So when the provider is also a patient, you also have this inclination to maybe protect your loved ones, because you are usually the resource, the medical resource for your family, your friends, and coworkers even. And so it's important to acknowledge that you perhaps have a certain degree of knowledge that is different from them, but also allow yourself to be the patient, allow yourself to be cared for. There's something called survivor guilt, and survivor guilt can come in many different ways. Survivor guilt can mean outliving some of the important individuals you met through your journey, maybe the person who sat in the chemo chair next to you while you were receiving chemotherapy. But survivor guilt can also come in the form of guilt that you are a burden to coworkers, to family, and to friends. And so it's important to accept help when the universe seeks to help you. Receive that help with open arms. Receive the love because you need it. So it's okay to be a patient. It's okay to receive help. Manage your guilt. Guilt causes stress, high cortisol levels. It's not good for your health. It's like a domino effect there. So it's okay to guide them. It's okay to know a little bit more, maybe more medical knowledge than your family and friends, but also allow yourself to receive that help and minimize your guilt.
I think those are great words of wisdom. So Edith, can you talk about how you define personalized healthcare in cancer care, and what impact does personalized healthcare have on the patient care journey from diagnosis through survivorship? And how can the patient advocacy community help to advance and advocate personalized healthcare?
Sometimes when we talk about personalized healthcare, the term itself can be confusing to people, because the reality is that cancer is always personal and always has been personal to the people that have been impacted by it and their families. And precisely when we think about personalized healthcare, it's really a shift from treating a disease to delivering care that is shaped by a person's individual needs and lifestyle and genetics and preferences all together. And in this way, we hope that we can help improve the experience and outcomes for patients. And in terms of the patient journey, we really believe that healthcare should be personalized at every stage of the patient journey. And that means harnessing the power of new tools and data to help ensure that we can get more early and more accurate diagnosis, personalized treatment plans and care plans that are really tailored to the needs, lifestyles, preferences, well-being of the individual. And when it comes to thinking about survivorship, that we can think about or leverage continuous and remote patient management with new tools that can help support an individual quality of life needs. So we still have a lot of work to do. And we recognize that to have adoption of this kind of personalized care, we are going to have to work together with every stakeholder across the healthcare ecosystem to make it possible. And patient advocacy organizations are really critical partners in this, and are absolutely important to help ensure that we can make PHC a reality, or personalized healthcare a reality for all patients. And first of all, helping ensure that we're looking at the outcomes that matter most to patients as we develop new solutions, and that we are studying and measuring those outcomes in a way that reduces the burden to those that participate in our studies, and that we deliver those outcomes in a way that takes into account the needs and preferences of the community. So truly partnering with the patient advocacy community at every step of the way is critical in development. But also, as we look at the broader healthcare ecosystem, there's a lot of work that needs to be done to ensure that we can enable adoption and incorporation of these more personalized integrated solutions. And just first of all, by sharing the powerful stories like the ones that Martin shared, to help share the power, the impact of tailored approaches to care, can be really, really important to drive stakeholders across the ecosystem to adopt these more tailored and personalized solutions.
It certainly seems after this past year, where we've had to pivot a lot in healthcare, that some of the lessons we've learned could be useful for better personalizing our approaches to healthcare, given the fact that we've had to meet patients where they are because of the pandemic, ongoing pandemic. So Agnesa, thank you very much for sharing your important work of the Living Charity Foundation. The translated NCCN patient guidelines seem to have had a tremendous impact on communication between patients and physicians in Russia. Can you describe an example of how the Russian NCCN guidelines for patients have impacted a specific patient's cancer care experience or a specific cancer journey?
Thank you, and I'm glad to be part of this webinar and to this conference event. The special example of what we are doing, we had a lot of thank you letters from different countries, because as you know, Russian language countries there are much more countries with Russian language. not only Russia, but also former Soviet Union countries. And these translations in Russian, they are the only source to get verified information about patient experience during different diagnoses in oncology. For example, a year ago, we had a 59-year-old woman. She has second stage lung cancer. And she never smoked, and she had good lifestyle, healthy lifestyle, but she got such a diagnosis. And she was in panic when she called our foundation, and she asked just one question: what should I do? Where to go to get better treatment and to get treatment in right way? First, we gave her the link to the guideline. She took just 3 days to get that information. Then she met with one of our oncologists, and then the whole process of her treatment and all decisions she made, it was very quick. So she made decision to start her treatment immediately, and used that guideline during her treatment all the time to communicate with doctor. And now she has very good results, and she's on supportive chemotherapy now. And doctors said that she has very good chances to become healthy. Also, what I want to say that many people who speak English, they knew about NCCN platform from our promotion, and they started to use also English language materials. For example, my friends, one of my friends, she had very bad diagnosis in oncology, and we used NCCN platform together with doctor to find better protocol which could be better for her. And now she also feels quite good, and we hope that everything will be good for her. So for us, for our community and for community of our doctors, it's a very important source of information, and it's a tool to communicate with patients, of course.
Great. It sounds like it's a wonderful way to both reach the patient and the provider with one platform.
Yes.
Going along the lines of translation, this is a question from the audience for Martin. Are the stories shared in your website or podcast translated into languages other than English? And is there a possibility to have stories in other languages shared through your platform?
So we do have some stories on the website that are in Spanish with English subtitles, but most of the part is in English at the moment. We work on a system where also the community can help us to translate stories. So our bigger vision is to have stories in other languages, which I think would be very interesting. But obviously it's a question of resources. So at the moment, the main chunk of the whole work is in English.
So Natalie, I'm going to come back to you. You work with Innovating Health International, and you've traveled to Haiti to perform surgeries and to train local obstetricians and gynecologists to perform oncologic surgeries. Can you describe some of your experiences in Haiti, and specifically, what are the most significant challenges and the opportunities to focus on in patient-centered care and shared decision-making in a resource-limited setting like Haiti?
Certainly, it's a humbling experience as a surgeon where I happen to be blessed and operate at a high volume cancer center where I have all sorts of latest technology at my disposal, unlimited resources, it feels like, and then operating in Haiti on patients who have advanced disease. Usually what we do, there's no radiation in Haiti, so you can't offer standard chemotherapy radiation for cervical cancer. It's a standard of care, but you can't do that because there's no radiation. So what we do instead is we offer neoadjuvant chemotherapy in the hopes of shrinking the tumor down and decreasing disease burden, which is successful most of the time, not all of the time. And when we are able to achieve that tumor reduction, then I examine the patients when I go to Haiti, and if they are if the tumor has shrunk, then I'm able to operate on them and perform radical hysterectomies. But I do this with one operating light that's perhaps dim and wandering and not standing still. We use a lot of instruments. We don't take them for granted like we do here. Instruments that are maybe considered disposable. Here in the United States, we actually reuse them, we sterilize them, and we reuse them again. So limited resources. And then, so that's as the surgeon. So now let's talk about being a provider and caring for women who themselves have limited resources. So there are just certain treatment options that we consider here because we know our patients are going to have resources that you think twice. Things like a colostomy. What's it like to have a colostomy in Haiti? Maybe we won't go there. Maybe we'll decide not to do that. Patients, so the hospital system here, I feel like our hospitals are more like hotel rooms. But in Haiti, there's no food, there's no great bed to go to. You're on the stretcher. You walk from the stretcher to the operating room, and you lie down on the operating room versus being transported. Lots of different things that you can potentially visualize for the patients that are different. But most importantly, the patient experience is the same. We're still human beings, regardless of where we are in the world. We may have different obstacles. We may have different access to resources, but the human condition, the fears and the guilt, all of these are similar, regardless of where you practice. So in some, the resources are different. The patient experience within their environment may be different, but emotions are the same.
Definitely. So going along the lines of access and different resources, this is a question from the audience for Edith, which is asking, how can we improve access to some of the novel, high-cost, targeted immunotherapies, especially when it comes to personalized healthcare? Cost is clearly a huge barrier in tailoring care to the person, especially in an emerging market or a low-income population. How can we potentially make this more equitable worldwide?
That's a great question that we think about every day. I think, first of all, thinking about sustainability and cost from the beginning. So making sure that what we are working on and what we're developing truly brings value to the patient and to society. That should be top of mind. Second of all, adoption of these new technologies will require a level of disruption, right? Obviously, there's a lot of healthcare ecosystem shaping that will be needed to ensure that these novel therapies are adopted, and it will require us, but also the medical community, payers, and other stakeholders, and of course the patient community to help shape it together. So we still have a long way to go, but I think we've already paved a lot of work in it, and there are certainly a lot of learnings that we have from the COVID pandemic that help us a little bit in that shaping. So I wish I had a better answer. I think a lot of work to do, but we're on our way.
So we'll get to a question about the COVID pandemic in a minute, but I do have one other audience question to Martin that I think is important. And this question was, how can I stay mindful of my cancer diagnosis and properly manage it daily without allowing it to be the primary focus each day. I think this is speaking to what that older woman who had multiple cancers spoke about. And what advice would you give to this person?
Yeah, it's a very good question, and I would answer it with just starting to define like what is actually a mindset or being mindful. Many people, or we believe that a mindset is just something fixed, something we're born with, or something that is in our DNA or character, but that's not true. A mindset is flexible, a mindset is changeable. We can shift mindsets and we can train it. And so when you ask me, like, how can you stay mindful and not think all the time about your cancer? Think about it if you manage to be mindful about another aspect of your life, maybe for a half an hour and go out for a walk, or, you know, like try to stretch the time more and more. Don't get overwhelmed when cancer is omnipresent. And then you see other stories from other survivors who pretend to be fine and everything is great, and you get even more stressed out, you know, like just accept where you are and then envision where you want to go, and just try to make little steps, and you will see over time you become better at it. It's a learning, it's a practice in the end. If I can compare it with modern medicine, I like this quote, just came to my mind, like, some people expect a change in their mindset without practicing. It's the same as if you would just wait the medicine to work by just reading the leaflet. You know, you have to put in the work, and it can be fun, and just try to do one step at a time.
This reminds me of a quote from Arthur Ashe: "Start where you are, use what you have, and do what you can." And I think that that's sort of the same mindset of picking up the pen to start the writing. So this is actually a question for everyone on the panel. And goes back to the unique perspective we are in the middle of a global pandemic. From your perspective, what has been the greatest impact of the COVID-19 pandemic on the cancer care community? And what can we do as a community to mitigate some of the consequences of the pandemic, but also to take advantage of some of the opportunities presented by the challenges faced during the pandemic? I'll let anyone answer that. Anyone can take that first.
I'll tackle that first. So I'm a glass half full kind of person to begin with. That has served me well my entire life. I have faced many, many obstacles way before my cancer and after. And the glass half full perspective has certainly served me well. So in that regard, technology, we advanced leaps and bounds during the COVID pandemic, offering all sorts of remote resources to our patients. My ability to stay connected with my patients via telemedicine was instrumental. And I kind of like going along with what I said earlier about getting to know my patient or my patient with cancer and their environment, being able to take a look around at the living room or the porch where they sat. I felt actually a little bit more connected with my patient, seeing them in their environment than sitting in my office. So I found that to be a positive twist on the pandemic. So a little bit more access to me. I did more phone calls, more video chats. Some of them were a little bit more informal, where we connected as human beings and not just as a patient provider. So yes, there were all sorts of negative things that occurred during the pandemic, but that's what I'll remember.
As a provider myself, I totally agree with that. Technology gave us the opportunity to see into the lives of our patients in a way we definitely couldn't have done otherwise. Other thoughts about the opportunities and challenges from the pandemic?
Yeah, I would like to pick that up as a patient, because I loved that I could have now calls with my doctor and don't have to go to the hospital and wait for hours. And it was in many cases so much easier. I saved so much time. And I have to say, this is also from a patient perspective, it was really an advantage of the whole COVID pandemic. But on a bigger scale, I think for me, the main takeaway or the positive impact that I see in this whole COVID scenario is it is somehow an example of the human resilience. If I think about it, we're having here this webinar. It's amazing how we could adapt, how we could have a behavior change on a global scale, that from 1 month to the next, everybody started to wearing masks, or maybe within 3 months, but incredible change. And I think for me, this is so motivating to also see that we can bring change to the cancer care, that the human mind is actually able to make a change if we really want to. And I found that very, very motivating. Yes.
Yeah, absolutely. This was a great example of how we could turn on a dime when we needed to. So going along with the idea of the way things have changed in the context of the pandemic, we have a question from the audience who is a breast cancer patient who's also worked in oncology and is willing to provide perspective as someone who was diagnosed and treated at the height of the pandemic. How can she and others get involved in helping shape current pathways within organizations? She sees online that pathways start to include patient perspective, which is a huge win, but how do you actually get involved in that if you're someone who is interested in providing a perspective to help shape an organization or other aspects of care? I'll let anyone tackle that.
Maybe I can start. I mean, I would say just reach out to that forum, to whatever organization, just reach out because there are many people willing to listen. And if they are not listening, you keep knocking on that door. And another opportunity could be through patient advocacy organizations themselves that oftentimes are already engaging with many stakeholders, advocating and speaking on behalf of the collective patient voice. So tons of opportunities, and very much encourage you to knock on those doors.
Yes, maybe I can tell about the experience in Russia. And in Russia, very important role are playing charitable foundations in this cases, because during pandemic we faced many challenges. All clinics were like COVID oriented, and many of our patients, they couldn't reach the doctors and hospitals. And now we became like mediators, yes, communicators between doctors and between patients, trying to make some changes and trying to get another ways for treatment for them, timely treatment. On the other hand, now we understood that the most important thing in this pandemic situation is to change communication between doctors and patients, to create another channels, help clinics to develop telemedicine, to work with psychologists with cancerophobia, for example, to try to listen more to patients, because when you are closed in one place and when you cannot reach hospitals and talk with doctors face to face, you need additional support, maybe online. So we are working now on communication programs. We teach doctors how they could act and communicate with patients in pandemic situation. This is the work of charity foundations with working with oncology problems.
So we're lucky enough to have people from all across the globe, and this is a question to everyone actually. As a survivor of a rare cancer, what's being done really to spread the word about those cancers and those patient journeys? This is a patient who has a gastric cancer, and trying to understand and connect with others that are going through that rare cancer experience as well. maybe we need to put more efforts into making sure that those cancers are acknowledged and brought forth. So speaking from your different perspectives, how do those rare cancers get light shed on them and connected to each other?
I'll start. So my patients who have rare cancers usually find through social media and online networks, patients who forums whereby patients with these rare cancers meet, they collaborate, they engage in charity events, they engage in advocacy programs, they network with larger cancer networks such as NCCN, American Cancer Society, the Institute for Cancer Research, World Cancer Research Fund, etc. But they start as a small group and collaborate with larger groups to advance the cause, whether it's awareness, whether it's raising funds for research for these rare diseases. There are many initiatives that can take place when you start with your small group, who oftentimes also serve as a support system.
Yeah, I think that's a very good hint. And to make it more concrete, a good place to look out are closed Facebook groups. You will find for every cancer type a group. And if you don't find one, then just start one, because probably someone else on the planet is also looking for this group. So that's also a good hint.
So we are unfortunately coming to the end of our time. We have lots of we have a couple of additional questions that we'll direct to the panelists at later times. But very briefly, in 2 sentences or less, what strategy would you implement in your professional roles to meaningfully advance patient-centered and personalized care from beginning to end, diagnosis to survivorship? Just a quick 2-second answer, and I will start with Edith.
Center the patient voice. So work very closely with the community at every step of the way.
And Martin.
So we're working on an academy program where we want to help patients better understand their mental struggle or mental health journey, and by doing that, empowering them to go through the treatment. So I would be very interested, Natalie, to learn more about your program, if there are any information out there. It sounded really, really interesting. Yeah.
And Natalie.
I'm really excited about this 8-week program that I created for GYN oncology patients. A like-minded physician at my institution coincidentally created something for breast cancer patients. I'm a breast cancer survivor. And I have data. My fellow just won first prize for his poster yesterday, presenting data from my program. So we have preliminary data. And boy, it's phenomenal, I think. I'm completely biased here, but I'm really excited as a survivor that we're able to offer this. So I'm happy to collaborate. And if you want a turnkey product that you can implement where you are, I'm happy to give you all of the resources, the entire curriculum. And I'd love for every patient everywhere to be able to benefit from something like this.
And finally, Agnesa.
We have 2 strategies, of course, continue to translate and promote Russian language verified information about oncology. Maybe we will start also work with professional information for doctors, and of course work with communities in Russian regions, in other Russian language countries, and with doctor communities.
Great. Thank you all for your participation in this panel. This was certainly great. And I'm going to turn it over to Katie to end.
Wow, what an amazing session. Thank you to everyone who joined us today. I would like to specifically thank Dr. Demlinger and our fantastic speakers for their expertise, insights, and really sharing their personal experiences. I would also like to thank our supporters of the webinar series. Again, without your support, we really wouldn't make this series possible, so thank you.
And lastly, thank you to the entire NCCN staff for helping to organize this event, especially Lee Gallo, Mike Abrams, and Mark Geisler for all their hard work behind the scenes to make this webinar a success. And before we conclude, I hope that everyone will join us again on May 27th. This will be the last webinar in the series. The meeting on May 27th will highlight best practices for patient engagement to really influence policy and policy-making decisions globally. So thank you again. Stay safe, everyone, and hope to see you next week. Bye.